First, Dr. Anthony Fauci said that the COVID-19 case fatality rate was 3.6%. That turned out to be a lie. The actual fatality rate of the virus is probably less than 1%, and for kids and younger healthy adults, it's virtually zero. Nonetheless, even though Fauci was totally wrong, we kept listening to him. Then Fauci said lockdowns work. This was obviously false. The places with the harshest lockdowns, like Los Angeles and New York City, have had the worst outcomes. And no, it's not because they didn't lock down soon enough. There is literally zero scientific evidence, and now, 9 months into COVID-19, zero empirical evidence that lockdowns work to stop the virus. Nonetheless, even though Fauci was totally wrong again, we kept listening to him. Fauci also said masks don't work, so please don't buy them, he told us. This is actually probably true of cloth masks, but Fauci later admitted he lied to us to manipulate us into not buying masks so that there wouldn't be a shortage for healthcare workers. Fauci lied to us to try to control our behavior. Nonetheless, we kept listening to him. Now, Fauci says, we need to reach 90% vaccination levels before we will reach herd immunity. Even though he said just a couple months ago that herd immunity could be reached at 60% vaccination or immunity rate. And Fauci admitted this week that he's deliberately moving the goalposts because he finally thinks the American people are ready to hear the truth. The absolute most despicable kind of politician, lying to us for our own good. Who listens to this guy anymore? Why are we still listening to him? And while we're asking questions, let's ask this. Why are people who've already had COVID-19 and recovered from it getting the vaccine? You might say, well, to protect against reinfection. But nope. According to a new study published in the New England Journal of Medicine, which followed 12,541 healthcare workers for 31 weeks after they'd had COVID, 6 months into the study, they found natural immunization was solid. They found only 2 cases of asymptomatic reinfections. So why are we vaccinating people who've already recovered from COVID? They don't seem to be at risk of reinfection, and natural immunization is better than artificial immunization. It makes no sense. Also, why are young and otherwise healthy healthcare workers getting the vaccine before it's offered to elderly people in nursing homes? It's not because the healthcare workers are at higher risk. They're not. Elderly people are at the highest risk, hands down. The only reason healthcare workers are being vaccinated first is because, as a University of Pennsylvania professor explained, healthcare workers are more racially diverse, while nursing home residents tend to be white. So in other words, the vaccine is being distributed according to critical race theory, not according to science. Speaking of science, why do people who aren't sick have to wear masks? You might say, well, to prevent asymptomatic transmission. But no. A new study from the University of Florida's Department of Biostatistics found that the secondary attack rate for asymptomatic index cases was not statistically different than 0. Why aren't we asking these questions? Why are we blindly following the say-so of a man like Fauci, who has been wrong on basically everything, and who has admitted to lying not once, but twice to the American people in order to manipulate us? If we don't ask these questions, if we don't demand answers from politicians and public health officials who are controlling our lives, we're no better than a nation of sheep.